Nagib Kurji. I'm 59, almost 60, and I'm a businessman and I run a catering business from home. I was playing golf and I felt a constriction in my chest, a pain across my back and down my arm. So I knew that these are the classic markers, a shortness of breath as well. These are the classic markers for some sort of cardiac issue. So once I finished playing, I did finish playing, the next day I went to see the cardiologist and he put me through the treadmill, which I really couldn't do very well indeed. I was having all sorts of issues with it. And we planned an angiogram. The angiogram then showed severe blockages in the heart, about 5 blockages. At that point, I thought I may only have to do stents, which is a less invasive procedure. But I was referred to the head of the department at Aga Khan University Hospital, the cardiac department, Mr. Andrew Duncan. We had a half-an-hour discussion, at which point he said to me, look, the stents you would need 12, which is way too many, and they would probably fail at some point. So his suggestion to me was a full sternotomy and open full heart bypass surgery. And he felt it would probably be about 3 or a triple bypass that would be required. I asked him if a mini bypass was possible, where they don't actually cut through your sternum, but they make an incision and use robotic tools. And he said no, because he didn't feel that he had enough room to do the work that he needed to do. But the amount of confidence he gave me at that point, that how professionally this was going to be done by him and his team, and at AKUH, I would say that my reaction was, let's get on with it and get it done. Mentally, I was already very positive because having had the history in the family, I knew that it was coming and it was something that I had to have done at some point. So I was very prepared for it mentally. Physically, I was fairly fit anyway, so I wasn't particularly worried about that. And I knew that I didn't have any other complications, such as kidney or liver or anything like that. So it would probably be an easier thing for me to go through. I knew that it was going to be a tough procedure and there would be a tough few days, but okay, you just live through those.
In terms of keeping us informed, I was with Nagib through the whole process. When he was admitted, when the doctor came, both the anesthetist and Professor Duncan, when they went through the whole process, I was there. When they took him into the preparation room the next day, I was there until just an hour before they wheeled him in. Once they wheeled him in, then I was in the waiting room and I kept getting constant updates from the nurses to say that everything was going smoothly, everything was okay.
That half-an-hour discussion with Andrew gave me all the information I required, really. It encapsulated it. And these things are actually quite common these days. Heart bypass surgery is basically plumbing. And whatever questions I had would be answered. But I didn't have that many because there's not much to know, apart from the fact they're going to open you up, fix your heart, put it back together and send you home. So I arrived at the hospital at about lunchtime. Upon admission, the Professor Lance, who is the lead anesthesiologist at the hospital, was waiting for me in my room. And he spent an hour with me explaining everything that the anesthesiologist was going to do, all the things, the tubes they were going to put in my body and what they were for. And it was so thoroughly well done that it just built my confidence even further. After that, a nurse accompanied me around the hospital to do the tests that I was required to do, which were blood tests, chest x-rays, and ECG. The nurse was with me at all times and I had full priority because I was going for surgery the next day. The day of the surgery is, I would say, more or less of a blur to me. The first thing I remember when I woke up is my family around me and some pain, which was managed. But apart from that, it was fine.
The first thing that everyone in the family has to understand is acceptance. Don't be in denial. Just because somebody in the family has a condition, it doesn't mean that you hide about it. We tend to hide our conditions. We tend to hide the fact that, oh, I've got cancer or I've got diabetes. There's nothing wrong in having this. There's no such thing as a perfect human being in this world. Everybody has some condition or the other. The sooner we accept the fact that we are not superhuman, we are human beings, and we will have these issues and we have to accept it and move on from there.
Now that I'm done with my recovery period, the thing I'm looking forward to the most is two things. One is being able to drive, because that's been a little bit hard not to do, and playing golf, because that's what I love doing. And basically be back to normal. And I think I'm almost there.
I believe we made the correct choice by doing it here, especially keeping in mind the fact that he is now in his comfort zone. He's in his own home, recovering in his own home. And I think because he's doing that in his own home, he's recovered much faster than he would otherwise have done.
The advice I'd give to somebody who's going to do this procedure, I would say do it here in Kenya, specifically I would say at the Aga Khan University Hospital, because it's a world-class facility, world-class care, the best doctors you can have, the best facilities, the best nurses, close to home. It's just perfect for anybody in this region to have it done here, rather than travel anywhere else in the world, where there'll be a lot more expenses that the insurance will not cover because it's available at that level in Kenya.